Heart contains four muscular sections that briefly hold blood before moving it. There are two ventricles and two atrium. The two upper chambers are called an atrium, with the left atrium and right atrium receiving blood into the heart. The right and left ventricle pump blood out of the body. It separates pulmonary circulation and systematic circulation. The tricuspid valve is located between the right ventricle and right atrium. The role of it is to control the blood flow. In addition, the mitral valve is located between the left atrium and left ventricle. Its role is to regulate the blood flow. The pulmonary circulation, it has a low pressure circuit from the heart, where the deoxygenated blood first enters the pulmonary valve and passes through the pulmonary artery. Then a gas exchange inside the pulmonary capillaries at this point flows through the lungs and back to the heart with oxygenated blood. The symmetric circulation carries oxygenated blood from the left atrium to the left ventricle. Left ventricle pumps the oxygenated blood to the body tissues and organs through the aorta. Next, it takes gas exchange, delivers nutrients inside the body capillaries, and passes through to the vena cava. Finally, repeats the process, therefore it goes back to the right atrium. The main function of the heart is to pump blood throughout the body. It is going to move oxygen, nutrients, and hormones all around the body through the circulatory system. In that case, it also takes away waste. Heart controls the rhythm and speed of the heart rate. There's a special electrical system called cardiac conduction system, which is located inside the heart, and the main role of the system is to control the heartbeat rhythm. Along with the heartbeats, there's an electrical signal from the top of the heart delivered to the bottom of the heart. As the signal travels, it will lead to the heart bumps and contract. This system helps the heart to maintain the proper circulation. An electrocardiogram is a quick test that uses a diagram to show a patient's heartbeats. A healthy ECG shows a smooth curve, and the heartbeats of the patient are between 60 to 100 beats per minute. It records the electrical signals in the heart. In that case, for a normal ECG, the T wave is always upright in leads V3 to 6 and always inverted in lead AVR. The QRS complex represents the polarization of the ventricle. The short QRS complex is ideal because it demonstrates rapid depolarization of the ventricle, which in turn means that the conduction system is functioning properly. QRS need to be 0.06 to 0.12 seconds, which shows a healthy ECG. The normal P wave is between 2.5 mm wide and 2.5 mm high. In that case, the PR wave is the distance between the P wave and the QRS wave, and the PR wave interval should be 0.12 to 0.2 seconds. Coronary heart disease causes when the heart cannot provide enough blood, oxygen, and nutrients. This is because of cholesterol deposition, since this buildup will cause the artery to narrow and reduce the blood flow to your heart. Then it will lead to chest pain, shortness of breath, and heart attack. Smoking is one of the dangerous factors that cause AD. Nicotine and carbon monoxide from smoke both put stress on the heart, make it work faster. The chemical substance inside the smoke will damage intima. Smoking will significantly increase the risk of AD. Moreover, high blood pressure would also be a factor because high blood pressure will cause strain on the heart. There are several ways to prevent CAD. Firstly, eating a healthy, balanced diet can help to prevent CAD. We can eat high-fiber diet like vegetables and fruit. Meanwhile, to reduce eating saturated food. Secondly, quitting smoke is important because smoking is a key risk that causes a heart attack. Smoking is a major risk factor for developing atherosclerosis, furring of the arteries.